Hi, Carlo Morrow from the School of Pharmacy at the University of Otago. I was just wondering, with the new funding and the new services, if there is an evaluation plan that you guys have built into doing this, and if not, why not?
Good question. So certainly in my area, we evaluate all of the new services that we put in, and we don't rely on that the first attempt is the right one. And this about evolving services, learning from what you're doing, and then modifying and keep that evaluation and the feedback loops to get the services working right is an important element of what funders do going forward and working with the communities around that. So there will certainly be evaluation, I would imagine, in all the DHBs around whether the investment is hitting the target and getting the outcomes that we want.
I was just interested in reading through the documents that the contract group and the expert advisory group will have defined terms of reference, and there will be no governance group, just a consultation process. And I think you probably need to be aware, if you're not already, that the sector is a bit wary of consultation processes. We've just been through one with our own pharmacy council where they were obliged to listen to our views. Fees were going up 56% over 4 years. 90% of the feedback was negative, and they just did what they were going to do anyway. So what safeguards do we have built in there if there's no governance group that consultation won't be something like that?
Are you offering to answer that, Alistair?
So I've got...
You just had that look.
Well, Carolyn's thinking, I'll give a response around this. So we don't have those sort of governance arrangements across many of the services that we do. We work closely with the local providers. So, for example, in the PHO space, yes, there's a national process to negotiate the contract, but we have an alliance where the PHOs and the DHB sit around the table and then agree and discuss about how we implement that in. And this is what this model gives that flexibility about, of working at a local level. So we have a clinical governance forum in the Auckland region where all of those clinical decisions, we have community pharmacists on it. They all have the input in terms of the service models, how we're going to measure those, and all of that takes into account, and we work with the providers then how to best implement that. So, this is where the local responses enable us to be more flexible and agile to deliver on the developments that we actually want to get in place.
So what we have in the contract, and I know that there's this governance group thing, but what we actually have in the contract is a process. And the process is really clear about how this works. And the other, it's picked up from aged residential care, the PHO arrangement. So that's tried and tested processes that have actually reliably worked in those sectors now for, I said, more than a decade. So I guess that's the learning, is that we've gone to a process that we know works and has worked for us in the PHO agreements and the aged residential care agreements, where we do what Tim describes. We all get in the room and we figure it out.
Well, look, I've sat around the Alliance table in Canterbury, and if that's the way it's proposed to be, I'm personally very comfortable with doing that in Canterbury, but I fear for my colleagues around the country who don't have a robust alliance process, and that's a challenge.
So here's an opportunity. It's true, and that's actually part of the commitment that we've made as DHBs. Now, first of all, some people in the room are on the national processes around PHOs and know how those processes work, and they've pretty robustly worked now since PHOs came in. We always get to an answer, don't we? We do, and we always get to a way we can work. But in terms of the alliance process that you mentioned, this is part of the journey that we're on, is to try and get that broader engagement in the alliance space and get that way of working better embedded. Now, we're well aware that some DHBs do that more strongly than others, but we as 20 DHBs have committed to working together and providing our shared capacity and capability across all DHBs.
It's not clear in the documentation the importance of the alliance.
That's a good point. Thanks, Richard. We'll have a look at that.